The distinctive pain of pleurisy is normally the first clue physicians use for diagnosis. We talk with Dr. Michael Lovy of Desert Regional Medical Center in Palm Springs, who explained the symptoms and treatments for this disease.
Pleurisy is just a description of a patient's complaint. The pleura, or the lining of the lung, is irritated or is a source of pain, and the patient will complain about is a discomfort in the chest wall when coughing, taking a deep breath, leaning over, or even moving the shoulder. It can radiate up into the shoulder, and it's usually a sharp pain and certainly gets your attention.
Dr. Lovy told us what causes pleurisy.
Pleurisy can be caused by any of a number of things. If it's serious stuff, could be infection. If you want to go by the odds, pneumonia. It's right next to the lining of the lung, and there can be irritation that way. Another very serious thing would be a blood clot to the lung, and that's why many patients have a sense of urgency when they have this severe, sharp pain beginning suddenly, something they didn't have before. They're going to go to the emergency room. Doctor is going to be thinking about blood clot to the lung. The ribs are right next door. If you had a minor trauma, you could pop a rib, and that could feel like pleurisy. If you have a gallbladder attack, go up to the side, the chest wall, that can feel like pleurisy. If you had a compression fracture of your spine, upper thoracic spine, and it irritates the nerve, it can send pain around the chest wall and have a pleuritic quality in terms of aggravation with movement or respiration. And then it can be any of a number of things, autoimmune problems like lupus or inflammation of the lung related to even rheumatoid arthritis. If you're normally healthy and you wake up with a severe pain in your chest and you can't breathe, I think I'm not going to call my second cousin. I think I'm going to go to the emergency room, or at least contact my doctor. But it also depends on what your general medical condition is. If it's complicated, if you have heart disease and you have hypertension, it's in the chest wall, it's going to get your attention. And I think another clue would be if there's a postural element to it. So if you can't lie if it's on the right side, you can't lie on your right or left side, or you can't remain recumbent in sleep, I think there may be something more going on. I always say if there's a fever, it kind of lets you know that something isn't right.
And we asked Dr. Lovy how he diagnoses pleurisy.
As far as diagnosing it, what you want to diagnose is what is the cause. There are certain things that you can hear on physical exam, which is like a noise like two balloons rubbing together. It's a very loud rub, and if you hear that, you know something serious is going on. But a chest X-ray can also show us some changes if we suspect a pulmonary cause.
What treatments are available?
The etiologies are so diverse. They can be anywhere from antibiotics to anticoagulation to, if it turns out to be a cancer problem, it would be cancer therapy, or if it's inflammation, it would be anti-inflammatories.